Hi there, my name is Emmy Moore, and I'm a Board Certified Behavior Analyst with DiNovi and Associates. Today's topic is the Premack Principle versus a visual schedule. We will cover 4th edition task list numbers D01, D03, E10, E11, and F01 throughout this video. Oftentimes, while supervising newer staff in the field, we find that there is a lack of understanding of the Premack Principle. It is often used interchangeably with a visual schedule. In general, how often do you hear someone utilize the language of, first we will have the math test, then a spelling test? To delve deeper into why this is inaccurate, we can look at the research. The Premack Principle is a first-then statement that identifies that a high probability behavior can be contingent upon a low probability behavior. A high probability behavior is a behavior that someone engages in more likely than not, and can be seen as a preferred activity. With that being said, the Premack Principle can be utilized as a reinforcement system, lining up a task demand of a low P behavior to be completed to access reinforcer or a high P behavior. In order to determine a reinforcer to use, you can complete a preference assessment upon initiation of services with the client or throughout if preferences change. It is not simply just something the client likes to do all the time, as that may not be motivating enough to complete low P or non-preferred tasks. Depending on the client, you can also ask the client what they want to work for in the moment. The Premack Principle can be presented verbally or visually through a first-then board, which is why I believe that there is often a mix-up with a visual schedule. Some examples of a correctly worded first-then statement would be, "All right, James, it's time to work on loading the dishwasher. First load the dishwasher, and then you can have time on your iPad to watch roller coaster videos." Or, "Catherine, what do you want to work for?" She says Skittles. Your statement can then be, "Okay, Catherine, first it's time to work on our weather cards. Then you can have Skittles." A visual schedule, on the other hand, is utilized to assist in predictability and routine. A visual schedule can present multiple activities and help individuals to plan for what is happening and where it is happening. These activities can be high P behaviors and low P behaviors interspersed. There is no contingency within the visual schedule. An example of a visual schedule may be a list of tasks in no specific order, such as imaginative playtime, tracing, Play-Doh, calendar, story time, teeth brushing. Overall, both of these tools are great antecedent strategies when used correctly. In practice, one may arrive at the session with a client and set up a visual activity schedule of various activities, preferred and non-preferred. When going through the schedule with the client before entering the activity and set up a visual activity schedule of various activities, both non-preferred and preferred. While going throughout the schedule with the client before entering into the activity that is non-preferred or low P, the clinician may utilize the Premack Principle. Remember, today's topics are antecedent strategies, so practicing clinicians would not use these interventions in isolation, but instead in tandem with consequence-based interventions. If you want to help disseminate the science, please like and share this video.